A bold new era for American healthcare is dawning, one that promises to strip away regulatory burdens and empower patients like never before. Welcome to the Deep Dive. Today we're plunging into President Trump's pretty ambitious healthcare and technology agenda. We've poured over a stack of sources for this one. We've got detailed briefing documents on the administration's goals, insights on AI deregulation, some analyses of healthcare in this Trump era, the specific AI action plan, and reports on new digital health initiatives, too. So our mission for this deep dive is really to explore how this administration aims to reshape healthcare. They're pushing accelerated innovation in medical technology, digital health.
Right. I think market-driven approaches, maybe less federal oversight.
Exactly. And fast-tracking cutting-edge AI, standardizing electronic medical records, aiming for, unprecedented patient access. But here's where it gets really interesting. This big push for efficiency, for domestic strength, it raises some vital questions.
I have a data privacy for sure.
Right. And that delicate balance between rapid technological advancement and making sure patient protections are really rigorous.
Yeah. Can America truly lead in medical innovation while safeguarding the deeply personal health information? It's a key tension.
Absolutely. It's something we'll definitely unpack throughout our discussion. Coming up, we'll dive deep into these groundbreaking changes, look at the crucial debates around your medical data, and reveal how these shifts could fundamentally redefine your healthcare experience. Okay, so to really understand this new direction, let's first lay out the foundational pillars of the administration's healthcare agenda. Our sources point to four main objectives.
Okay.
First, a strong push for market-driven access and competition. They want to encourage transparency to broaden access.
Makes sense.
Second, it's all about state and individual flexibility, giving you more control over your healthcare choices.
More control. Okay.
Third, a clear focus on deregulation, specifically rolling back Biden-era policies to reduce administrative burdens.
Less red tape.
And finally, a big one, national security and healthcare independence. Bolstering domestic manufacturing, reducing reliance on foreign sources. That whole America First principle.
And then America First principle is particularly interesting when you look at pharmaceuticals.
So?
Well, the goal is clearly stated. Reduce reliance on foreign sources for making healthcare products, especially drugs.
Right, domestic production.
Exactly. But it's not just about having factories here. It's framed as strengthening supply chain security, which, after recent global disruptions is a pretty significant national security concern.
Definitely.
But here's a catch, or maybe the paradox the sources highlight. Bringing production back might not automatically mean lower drug prices for you, the consumer.
Why not?
Well, think about it. Higher labor costs in the U.S., maybe stricter environmental rules, potentially less economies of scale compared to established overseas plants.
So making it here could actually cost more to produce.
It potentially could, yeah. The sources suggest that.
That's concerning for patients hoping for lower prices. So if lower prices isn't the automatic outcome, what are the sources suggesting counters that, or is the priority just security?
That's a really good question. The sources don't really offer specific ways to counteract those potential higher domestic costs. They emphasize that the main driver seems to be resilience, supply chain resilience, national security. Those seem to be prioritized over immediate consumer price reduction. It looks like a trade-off.
Okay, that clarifies the priorities then. Security over immediate cost savings, potentially.
Seems that way, based on the material.
All right, let's pivot now to AI and MedTech. This is clearly a massive focus for this administration.
Sure.
The AI Action Plan for America, it's incredibly ambitious. It aims to secure U.S. dominance in AI.
Right, through deregulation, big investments in infrastructure, and even a global export strategy for American AI.
And they're really talking about accelerating innovation here. The report suggests that reduced federal oversight on AI and medical tech is expected to, fast-track development.
Yeah, in things like diagnostics, treatments, even just managing healthcare better overall.
And are there specific mechanisms mentioned for how they'll do this fast-tracking?
Yes, actually. The blueprints seem quite concrete in places. The FDA, for instance, might set up what they call regulatory sandboxes.
Sandboxes?
Yeah, or maybe AI centers of excellence. Think of them like special zones, controlled environments, where new AI tools can be tested and deployed into healthcare much faster. It allows for speed, but, still within some kind of monitored framework.
Okay, regulatory sandboxes. That makes it sound less like a total free-for-all, more like controlled acceleration. I like that analogy.
Exactly.
And speaking of acceleration, tell us about Stargate. That name alone, that sounds pretty monumental.
It is. Stargate is described as a massive $500 billion venture involving several tech giants.
500 billion, wow.
Yeah, it's not just a big number. It represents a really concentrated effort to build essentially supercomputing power, specifically tailored for healthcare AI.
So what does that enable, practically speaking?
Well, imagine processing just vast data sets, millions of patient scans, genomic sequences at speeds we couldn't really imagine before. This kind of rapid analysis could seriously accelerate discoveries, things like spotting cancer much earlier or developing truly personalized drugs. It could be groundbreaking stuff.
Groundbreaking, absolutely. But let's connect this back. While that acceleration sounds amazing, you mentioned perils with AI deregulation earlier.
Right. And the sources are pretty clear on this. They point directly to increased liability risks for the medtech firms themselves.
How so?
Well, with less stringent federal oversight, if an AI system makes a mistake or causes harm, the company could face more legal challenges, more operational headache. They might be more exposed.
So if the government steps back on oversight, are companies just expected to police themselves more? And crucially, what does that mean for patient safety?
That's exactly it. It puts the onus squarely on the medtech firms. They absolutely must develop strong internal risk management, robust self-regulatory frameworks.
To manage safety and efficacy themselves.
Precisely. And to make sure their AI meets ethical standards, protects patients. It's a big responsibility shift.
And does this raise trust issues?
It certainly could. Critics, according to the sources, warn that this deregulation might weaken safeguards under HIPAA.
HIPAA, right, the big privacy law for health info.
The very one. Weakening that or reducing oversight on issues like bias in AI algorithms or how transparent they are, that could really damage public trust, especially for AI used directly in your care. Plus, there's another wrinkle. The AI action plan is apparently quite vague on important things like intellectual property, copyright issues, especially around the data used to train these AI models. That's another challenge for companies trying to innovate in this space.
That definitely sounds like a double-edged sword with AI, speed versus safety and trust.
Absolutely.
But this whole push for digital transformation, it goes way beyond just AI, right?
Yeah.
Let's shift to the new digital health initiative. Our sources say the administration is launching a huge new initiative. The main goal, making your personal medical data much more accessible, right on your digital devices.
And it's a big collaboration, apparently.
Massive. Not just a small government pilot. It's backed by over 60 leading healthcare and technology companies. We're talking huge names. Google, Amazon, Apple, Humana, United Health Group, Oracle, Cleveland Clinic. The list goes on.
Wow, that's quite the coalition. And what are the key focus areas?
They seem pretty specific. Things like diabetes and weight management, using conversational AI, chatbots maybe, to help patients, and practical digital tools. Think QR codes for checking into appointments or tracking your medications.
So convenience and engagement tools.
Seems like it. And the big push behind it all is interoperability, making your health information flow easily, interoperable and shareable across different technologies and tools.
Okay, making data flow is key. What about control and privacy?
Well, the administration's assurance, according to our sources, is that the whole system will be entirely opt-in.
Opt-in. So you have to choose to participate.
Right. And crucially, no centralized government-run database. They emphasize that doctors and patients will keep control.
Yeah.
There's even a plan for a digital app library on Medicare.gov to sort of highlight trusted tools for prevention, chronic disease management.
Okay, so it sounds incredibly empowering for patients on the surface. More access, more tools.
It sounds empowering, yes. But this is where that tension between convenience and privacy really flares up.
I bet. What are the experts saying?
They're raising enormous ethical and legal concerns. The worry is that medical records could be used in ways that actually harm patients or their families.
Harm how?
Well, digital privacy advocates are pretty skeptical that this data will be stored securely. They point out that the federal government hasn't historically regulated health apps very strictly, especially once they're off an official platform like Medicare.gov.
That's a critical point.
Yeah.
Because medical records aren't just your address and date of birth.
Exactly. They contain incredibly sensitive stuff. Doctors' private notes, maybe history of substance abuse, mental health details.
Things you absolutely don't want misused or exposed.
Right. So there's a real fear mention in the sources of further use and monetization of sensitive and personal health information once it gets into these potentially less regulated third-party app systems.
Monetization. Selling your health data, basically.
Or using it for targeted advertising, insurance decisions, employment. The possibilities are worrying.
And we can actually look at a real-world example of the challenges here, right? The VA's new electronic health record system.
Oh, right. The EHR rollout. How's that going?
Well, it was launched way back in 2017. But it's still only fully implemented in 5 out of 170 VA medical centers.
Only 5 after all this time. Why the delay?
The sources point to developmental problems with the system itself and also inadequate staff training. It just highlights how incredibly complex these large-scale digital health overhauls are.
Especially for a system as vital as the VA's. That EHR is supposed to help veterans transition smoothly from active duty, keep their records continuous, combat isolation.
Exactly. So those delays and problems really underscore the practical hurdles involved, even before you get to the broader privacy concerns of a consumer-facing initiative.
Yeah, that VA experience definitely puts the challenges into sharp perspective. It makes you wonder how those lessons learned or not learned might apply to these even bigger, broader initiatives.
It's a fair question.
Okay, let's broaden our view again, maybe to more general healthcare policy shifts, starting with the Affordable Care Act, the ACA.
Ah, yes, the ACA. Always a topic.
Indeed. The administration is expected to keep pushing for repeal, but the sources say specifics on what would replace it are still pretty unclear.
So repeal efforts continue, but the replace part is fuzzy.
Seems so. One potential shift mentioned is ending the ACA subsidies, the financial help many people get to buy insurance, and maybe redirecting that support towards health savings accounts, HSAs.
HSAs, those tax-advantaged savings accounts for medical costs.
Right. But shifting fully to HSAs could mean higher out-of-pocket costs for some people who rely heavily on those ACA subsidies now.
A significant potential impact for individuals.
Definitely. Although it's also worth noting, the sources mention that congressional Republicans seem a bit reluctant to jump back into a full ACA repeal fight. It's become pretty embedded.
Understandable given past political battles. What about changes to Medicaid and Medicare?
Also on the agenda, for Medicaid, the proposals include things like work requirements for beneficiaries, maybe changing eligibility rules, and giving states more flexibility in how they run their programs.
Which could potentially lead to fewer people enrolled in Medicaid.
That's the potential outcome analysts suggest, yeah? Especially among working-age adults.
Okay. And Medicare.
For Medicare, the stated intention is to protect the program's financial health. They also want to expand the $35 insulin price cap, which was popular,
Right.
and enhance price transparency, making cost clearer for patients.
But does transparency actually lower costs?
That's the question. Sources caution that just knowing the price doesn't automatically make things cheaper. So while transparency is a goal, it might not fully tackle rising costs for seniors on its own.
What about drug pricing overall, beyond insulin?
Well, this is interesting. The administration may delay or cancel drug price negotiations under Medicare. Those negotiations were a key part of recent legislation.
Delay or cancel them. So less direct government negotiation on prices.
Potentially. The focus might shift back towards transparency laws instead of direct negotiation.
Okay. And what about the Inflation Reduction Act, the IRA? That funded a lot of these healthcare initiatives.
Right. The administration has vowed to rescind all unspent funds from the IRA.
Rescind unspent funds. So claw back money that hasn't been allocated yet.
Essentially, yes. While a full repeal of the IRA is seen as unlikely because a lot of money is already committed, jobs created, etc., the sources do say that unspent funds and unsigned contracts are still vulnerable.
So some parts of the IRA's funding could still be rolled back.
That seems to be the assessment. But despite those potential cuts and shifts, there's one area of clear expansion that sounds like good news for many patients. Medicare telehealth services.
Telehealth.
Yeah.
That really took off during the pandemic.
Exactly. And the administration has finalized a permanent expansion. This is huge, especially for people in rural areas where getting to a doctor can be tough.
So more virtual visits covered permanently.
Yes. Over 60 services will continue to be covered by Medicare, even beyond the public health emergency context. Imagine not having to travel hours for a quick follow-up.
That's a big deal for access.
Absolutely. And CMS, the Centers for Medicare and Medicaid Services, they're even studying these telehealth flexibilities further, looking for future opportunities in virtual care.
Good to see that positive momentum continue.
Definitely a bright spot for access. Okay, so to wrap up our deep dive, let's touch on the leadership who might be shaping these changes and what it all means strategically for the healthcare industry.
All right. Key players and industry impact.
Our sources mention some potential key appointments. Robert F. Kennedy Jr. as the nominee for HHS Secretary, Health and Human Services.
Okay, RFK Jr. at HHS. What are his stated priorities?
Well, the sources say his focus includes cleaning up corruption, stopping the revolving door between industry and government regulators.
Shaking things up.
Seems like it. Also returning health agencies to evidence-based science, supporting drug price caps, shifting NIH research focus towards preventative and holistic health.
Interesting mix. Price caps, but also holistic health focus.
Right, and maybe vaccine skepticism and even potentially banning direct-to-consumer drug ads, the ones you see on TV.
Wow, banning DTC ads would be a huge change for pharma.
Massive. And then there's Dr. Mehmet Oz, nominated to be the CMS administrator running Medicare and Medicaid.
Dr. Oz at CMS. What's his stated aim?
The sources say his focus is on cutting waste and fraud, describing CMS as our country's most expensive government agency. He's also noted as a supporter of Medicare Advantage.
Medicare Advantage, the private plan options within Medicare.
Exactly. So potentially a push towards more privatization or private plan involvement in Medicare.
Okay, so with these potential leaders and all these policy shifts we've discussed, deregulation, AI push, digital health, ACA changes, drug pricing uncertainty. What does this mean for healthcare companies? How should they navigate this?
And by extension, what does it mean for you, the patient, as these changes ripple through the system?
Well, it certainly raises important strategic questions for the industry. And these have downstream effects for patients. Firms will likely need to reevaluate their pricing models. How do they stay affordable for patients but also profitable? Especially things like Medicare price negotiations change or Medicaid funding shifts.
Right. Pricing pressure.
Definitely. They'll also need to seriously look at optimizing their manufacturing and supply chains. That America First push means investing in domestic production makes strategic sense, reducing reliance on foreign suppliers and mitigating those geopolitical risks we talked about.
Building resilience.
Exactly. And, just holistic financial planning becomes crucial. Companies need to assess how all these potential reforms could impact their bottom line, their revenue, where they put their resources.
Makes sense. What about the AI aspect specifically?
Critically, given that potential for reduced federal oversight we discussed, MedTech firms really need to double down on strengthening their internal governance for AI.
Self-policing again?
Pretty much. Ensuring their AI meets high ethical standards, protects patient safety, manages bias. Because the external guardrails might be lower, it really shifts more responsibility directly onto the industry itself.
So putting it all together, this deep dive really shows us a healthcare landscape that looks poised for some significant transformation, driven by this administration's focus on deregulation, market forces, and that push for rapid technological advancement. It's certainly a lot to process.
It is. The ambition is really clear. Accelerate innovation, give individuals more access to their data, more choices. That's the promise. But the real challenge, I think, for you, the patient, the consumer, will be ensuring that while all this technology opens exciting new doors, that fundamental right to privacy, the ethical use of your incredibly sensitive health information, making sure those remain paramount.
That's the core tension, isn't it?
It really is. So maybe the question for you to think about is, what steps might you take to protect your own digital health footprint in this kind of evolving environment? And what questions will you start asking your doctors, your insurers, maybe even your policymakers about how your data is being used and protected?
Those are really important questions for everyone to consider. That's our deep dive for today. We hope this exploration helps you feel a bit more informed and ready to navigate these important shifts happening in healthcare. Until next time, keep digging deeper.